We are with House Majority Leader Kevin McCarthy right now. And Congressman, I want to ask you your thoughts about where this heads next, because we all know the Senate is basically saying we're going to start anew, right? I mean, I had Bill Cassidy on yesterday on Sunday Morning Futures, and here's what he said about the overhaul. Listen to this. Got to get your reaction.
You hope so. It's really important. Obamacare premiums continue to climb. Insurers keep pulling out of markets. I'd love to have some cooperation from the Democratic Party, which so far they've not cooperated at all, because it's important. Whether it's a blue state or a red state, these insurance markets are escalating in cost and in some cases imploding. So we'd like to get it done this year. If the other side decides not to help, it makes it harder.
So he's got his own Patient Act, he and Susan Collins. How does that jive with what you just did?
Well, there's a number of senators over there that have different ideas. They are their own legislative body. I have no problems if they write their own bill. If it took the House passing a bill to get them moving on a bill, I thank them for that. But whatever they do, they need to act, because more people are losing their health care. Premiums are continuing to rise. So that's the way the system is set up. We move legislation, they move legislation. Any difference will go to conference and then send it to the president. But I think the timing is important, that they need to start working, but they have been working. We've worked with a number of senators. I know McConnell has set up the working group well ahead of the time. I think this just adds a little added pressure to them that they have to act. And remember, when you have a new administration, there are 1,200 positions that have to be confirmed. And remember what the Democrats have been doing. No president has to wait this long to try to get a cabinet confirmed.
Incredible.
So they've been going through that and the Supreme Court at the same time. So I think now the focus can be, after we got our budget funding bill through, on the Senate side, on health care.
Yeah.
So I expect them to do it, and I don't think it'll take that long for them to act.
I want to ask you how tough it's been working and doing all of that you've been doing without any Democratic support, because it is pretty incredible. But first, explain to us what you did in terms of making the changes that you made in the last couple of weeks. You and I had a conversation, and you were saying taking the sick people out of the pool is actually effective because it is going to lower the cost for the broader pool. So explain pre-existing conditions and the changes you made.
Well, what's so frustrating out there, we protect pre-existing conditions. And remember, we're talking about the individual market. So if you have Medicare, this doesn't deal with you. You have health care from your company, this doesn't deal with you. So Obamacare did three things. They took greater control of government over health care. They created the exchanges, and they expanded Medicaid expansion. So what we go in and do is 1% of the population would it take about 23% of health care expenditures. 5% will count for about half. Prior to Obamacare, there were some states that did very well with high-risk pools. If you take a Wisconsin, if you were in Wisconsin and if you had cancer, you were put into a high-risk pool that gave you 9 different plans. You were not restricted from going to any hospital or any doctor. The price of that premium was actually less than paying for the ACA today in Wisconsin.
Wow.
Without. Well, ACA took away high-risk pools. So what we do is we allow states to bring them back. So if you take those individuals that need some of the greatest care and allow them to have it, and then you're taking a pool that's a different size with that care out of it and government inside helping there, the premiums will lower. That's the part of what we're trying to get premiums lower, more choice, more options, and the individual to go into the market and choose. I watched you look at all these different cable choices that are going on. You got more choices in cable than you ever do in health care.
That's right.
And government mandates what you have to take. Well, people have, in different parts of their age, they look for different things. Sometimes they'll stop looking for maternity, or sometimes they'll be looking for braces. There's different options they want. Why don't we let the individual to choose that? And the market will actually drive down when they start having more plans to offer.
So that will create the choice that will lower the cost.
You know, the
competition.
Exactly. And the interesting little fact that nobody talks about, I didn't hear the president's quote, or the former president quote this last night. More people took the penalty or the option than signing up for Obamacare. So
they're basically just saying, I'll pay because I can't deal with the deductions and the cost.
And let's remember, the individual market in Obamacare is 7% of those that have health care. So remember what we're dealing with here, but we're giving people greater choice, the options of premium coming down, because we're putting in choice for individuals. More companies will come in. They tell us every day, instead of pulling out, They'll give more options. Maybe I just take a high-risk deductible. Maybe I take a catastrophic. Maybe I put an overall plan. They'll adopt a plan to what you're looking for.
Will it be the Medicaid expansion that the Senate tries to chop or change?
I've heard talk from a lot of senators, and they can change whatever they want. That is their prerogative as a legislative body. Now, the Medicaid expansion, the reason why, and this is where I think, when I listened to what President Obama said last time, yeah, it takes courage. Okay, expansion, Medicaid was created for the poor, disabled, and pregnant. And what you would get is it's called an FMAP. That's about 50% roughly. The feds would pay and the state would pay the other. What Obamacare did was expanded that to people over 130% of poverty, able to work, and government would start paying 100%, go to 95 and 90.
Bigger and bigger government.
Well, if you look at a 10-year window, in the 10th year, that 1 year will cost us $1 trillion. Well, $1 trillion was about as much as we spent to fund all of discretionary government last week. So we've got to do something. What we do is keep the promise. Anyone who is currently on Medicaid through the expansion, we keep that commitment. And we keep it till 2 years going forward. Now, coming back in, if you come back on into Medicaid, we go to the lower rate of the 50%, but we give all this freedom to states on flexibility. You want to know how crazy it was? We have one governor, I had this bipartisan group of governors come in. He had to ask the federal government if he could email those on Medicaid. They spent about 8 months trying to do it. Then they got an email from the federal government denying them the right to communicate to those on Medicaid. It would have saved them roughly $200 million.
Wow.
They could have put into other plans.
That's incredible. What a waste of time and money. All right.